Hi, welcome to another episode of Youth Diary. Skeletal system is the supportive system for the body. It gives shape and mobility to our body. And to talk more about it, we have Dr. Raj Mohan with us. He is an orthopedic and reconstructive surgeon at Rene Medicity, Palarivattam. Hello, doctor. Welcome to our show. Doctor, can you just explain what is a reconstructive surgery of joint?
Joint normally means that the place where two bones meet. The ends of the bones which are meeting are covered with a smooth surface called cartilage, and that gives a smooth gliding movement of the joint. But in degeneration, this smooth articular cartilage is lost, and in that place you get a roughened bone. So when the joint moves, these roughened bones rub against each other and causes pain. So in such severe conditions, it cannot be cured with just medicines, and we may need a joint reconstruction surgery. In joint reconstruction surgery, we remove that damaged layer from both sides of the bone, and in that place we put an artificial layer, and then the movement occurs between the smooth artificial layers and the pain disappears. This is what is briefly described as a joint reconstruction or joint replacement surgery.
What is the incidence of a degenerative disease of joints in our society?
Joint degenerative disease mainly type like mild, moderate and severe. Mild occurs in almost 80% of the patients above the age of 35 years. And moderate and severe depends on their obesity, their nature of job. And mostly it's mild disease that occurs in 80% of the cases. Joints commonly involved in the joint degenerative disease in our body are those joints which are more actively involved in our day-to-day activities. For example, the neck or the cervical spine. It's mostly involved in people who are working in the computers, so that can lead to a degeneration of the cervical spine called cervical spondylosis. And then comes the lumbar spine or the back. Again, it is mostly involved in people involved in sedentary jobs who sit for long hours in faulty postures.
Like drivers?
Like drivers and even clerks and those who are doing the sitting job. They don't maintain a proper posture. That can lead to degeneration of the back. Then comes the knees. It's again seen in people who are obese, overweight, and those who have to walk along, who have to walk more staircase, more stress to the knee, causes the osteoarthritis of the knees. So most commonly it's the neck, back and the knees.
Okay. So what are the symptoms of this joint degeneration, doctor?
Again, it depends on the joint involved, but initial stage you get pain only in the extremes of the movement of the particular joint. For example, if the cervical spine is involved, you notice when you have to turn for doing a reverse or when you look up, you'll get some pain. That is the initial starting stage. But as the disease progresses, the pain will be there even during rest, and it can come down your arms. And again, the back also. Initially, the pain will be there only when you stoop down, bend down, and all. And later, when it is severe, it will be persistent. The knee also, the knee degeneration, the pain you get initially only while getting up from the sitting position or when you climb stairs or climb downstairs. Initially, these are the symptoms, early symptoms.
Doctor, along with this pain, will there be any inflammation or edema or swelling of the joints?
As I mentioned, when the rough bones rub against each other, it's the body's reaction to produce fluid around the joint, which we call as effusion. So when damaged joints move, you get a fluid collection around the joint. It's called effusion.
Okay, we'll see the next question, doctor.
Hi, I'm Manish. What are the work-related risk factors in causing joint damages?
The work-related risk factors, again, mainly it is related to what is called as ergonomics. That is, especially in the modern kind of jobs. Now, a lot of stress is being given to these ergonomics. That means you have to maintain a proper posture while working, especially when people work in front of the systems for long hours. You have to maintain a proper posture, and the neck has to be steady, and the monitor has to be at the level of the eye. And if you don't listen to these ergonomics, then it can spoil your joint. And another thing is that when those who are involved in sedentary jobs, they tend to put on more weight because their lack of exercise, and the overweight can lead to lumbar spondylosis, the pain in the back, that can damage the knee joints in long course. So these are the normal work-related stress related risk factors seen in jobs.
How can we prevent these things? Like, is there any preventive measures?
Again it comes to a proper posture, as I mentioned earlier. You have to maintain a proper posture, and regular exercise is another, because what was said and done, these jobs have to be done, and in between the jobs, now these offices, they have, I heard that they have gym facilities, etc. And you have to exercise those muscles which are commonly under stress. For example, if somebody is using computer, they have to do more exercise for the neck muscles. If somebody is sitting for a long time, they have to do more exercise for the back. And again for the knee muscles. If you can strengthen the muscles around the damaged joints, that rubbing will reduce, and gradually the pain we can maintain control with this exercise and muscle strengthening.
Doctor, one more doubt here. Nowadays everybody goes to gym, especially the youth. What about this vigorous exercise? Will it adversely affect the joints?
Yeah, definitely. Doing gym is definitely a good thing, but if it is under a proper guidance of a good trainer. But if people go without proper training and they overuse, a lot of damage can occur in the muscles, tendons, as well as the joints. For example, suppose some person is taking a huge weight and doing this exercise for the deltoid repeatedly and on every day. Normally, one muscle is stressed, worked for one day, then it has to be given rest for at least 3 days minimum. Then only it has to be repeated again. But some people do vigorous exercise, some particular muscles like the biceps, so as to build up the muscle. But it's more harm, it causes more harm than good, because when it is overstressed, the tendon, that is the portion of the muscle which attached to the joint, can break. It's sometimes called supraspinous tendon rupture. Now it's happening not very rarely. So suppose it happens, then we may have to do a surgery or an operation to repair the tendon. And muscle can damage, it is overworked. A lot of toxins accumulate inside the muscles, and in due course the muscle can damage. And when it comes to joints, again more load is, some people take a lot of weight and do sit-ups. So that puts some extra, more than 10 times load onto the knees. And if it is done on an everyday basis for a long time, that can damage the smooth articular cartilage of the joint, and it causes more damage than good.
So Doctor, one more doubt here. When we use a treadmill or using an open ground for running, which one is more beneficial or which one is useful?
Yeah, definitely open ground is definitely better, because whatever said and done, the treadmill is made on a platform, and when we run on that platform, there can be small vibrations, and which causes some forces which can be transmitted up the bone and cause some damage in the long run to the knee. But it's not always practical to go and run in the ground because of it's rain and a busy schedule. But you can use a treadmill, but if you have to take some precautions. For example, you have to use a proper footwear, shoe, so that it can absorb whatever stress is caused. And don't use a high speed, because it causes more vibration. Moderate speed and do more time, take more time rather than high speed and small time.